Hello. So in this video, I'll talk about the brachial plexus. Okay. And the way I'll talk about the brachial plexus is that if you look at the objectives, so I'm going to introduce the brachial plexus. I'll talk about the components of the brachial plexus. And lastly, I'll talk about the clinical application of the brachial plexus. So if you look at the brachial plexus, these are network of nerves that arise from the neck region. Okay, they are formed by the ventral rami of C5 to T1. So these are known as roots. So these come directly from the spinal cord at the level of C5 to T1. So you have C5, C6, C7, C8, and T1. So this network of nerves, they'll come together to form the brachial plexus. So after arising from the neck region, these nerves enter the axilla through the apex of the axilla. And if you look at the apex of the axilla, it is bounded anteriorly by the clavicle, posteriorly by the superior border of the scapula, and medially by the first rib. So the apex of the axilla forms a triangle, and through that triangle, that's where these nerves, they'll pass through to enter the axilla. And from the axilla, they'll continue moving downwards towards the upper limb. These nerves basically innervates the upper limb. Okay. So if you look at the brachial plexus has the following components which you have to know. So first of all, you have the roots, which I've talked about in the introduction. Like you have 5 roots, which arise from the ventral rami of C1, C5 to T1. These roots, they'll come together to form the trunks. So you have 3 trunks I'll talk about nicely: the upper trunk, middle trunk, lower trunk. So these roots, they'll come together to form the trunk. So you're going to have the upper trunk, middle trunk, and the lower trunk. Then from the trunk, these trunks, all the trunks are going to divide into divisions, the anterior and posterior divisions. So each trunk is going to divide into an anterior division and a posterior division. Even from the middle trunk, you're going to have the anterior division, the posterior division. Even from the lower trunk, you're going to have the anterior division and the posterior division. Then the divisions come together to form what are known as cords. So the cords, you have 3 cords. You're going to have the lateral cord here. You're going to have the posterior cord there. So sorry, okay. So you're going to have the lateral cord above, the posterior cord there, and you're going to have the medial cord. Then from the cords, you're going to have the terminal branches. Like from the lateral cord, you're going to have the musculocutaneous nerve arising from it, as well as a branch that's going to participate in the formation of the medial nerve. Okay. From the posterior cord, it's going to terminate into the axillary nerve and the radial nerve. Then from the medial cord, you're going to have the ulnar nerve and the branch that's going to participate in the formation of the medial nerve. So the medial nerve is formed by 2 branches. One branch coming from the lateral cord and the other branch coming from the medial cord. They'll come together to form the medial nerve. So these are the terminal branches. So this is just an introduction. So I will put a whiteboard I'll try to draw this down nicely before I continue. Okay. So like what I said, when you look at the brachial plexus, it is made up of the nerves And these nerves, they'll pass through the axilla. Then from the axilla, they'll continue going downwards to supply the muscles of the upper limb and the skin. So the muscles and the skin of the upper limb. So the brachial plexus is made up of nerves that arise from the ventral rami of C5, C6, C7, C8, and T1. So these nerves that are going to come from the spinal cord, from the ventral rami, are known as roots. Okay? And from the roots, we go to the trunks. So those are the components. The first nerves are the roots. Then after the roots, you're going to have the trunks. So now from the trunks, I said you have three trunks: the upper trunk, the middle trunk, and the lower trunk. So the root of C5 joins the root of C6 to form the upper trunk. So the upper trunk is formed by the root of C5 and C6. The root of C7 continues. It does not join any other root. It will just continue to form the middle trunk. And the root of C8 joins the root of T1. Sorry. So C8, just a minute. So the root of C8 joins the root of T1 to form the lower trunk. So you have three trunks. Okay. So we started with the roots. Then we've gone to the trunks. Okay. Then, like I said, all the trunks are going to divide into the anterior division and the posterior division. So let's say this is our anterior division in red. Then I can change the color to black to show the posterior division. Okay, so this is our posterior division in red. This is our anterior division. So even for the middle trunk, it's going to divide into two divisions. So I'll start with the posterior division. So it's also going to divide into the posterior division, P, and the anterior division. That's going to go like that. Anterior division. So even for the lower trunk, it's basically the same. You're going to have the anterior division in red, and you're going to have the posterior division. So one unique thing or feature which you can see is that all the posterior divisions come together. So the posterior division of the upper trunk will join the posterior division of the middle trunk, and again the posterior division of the lower trunk will also go to join those two posterior divisions to form what is known as the posterior cord. So all the posterior divisions are going to come together to form the posterior cord. Okay, so for the divisions, we have 6 divisions. So 2 coming from the upper trunk, 2 coming from the middle trunk, and 2 coming from the lower trunk. Okay, and all the posterior divisions. So here I can put division D. So all the posterior divisions come together to form the posterior cord. Then when you look at the anterior division of the upper trunk, it unites with the anterior division of the middle trunk to form the lateral cord. So here we have the lateral cord. So the lateral cord is formed by the anterior division of the upper trunk as well as the anterior division of the middle trunk. They'll come together to form the lateral cord. Then if you look at the anterior division of the lower trunk, it doesn't join any other division. It continues as the medial cord, not middle cord, but medial cord. So here now we have our cords, 3 cords. The lateral cord, the posterior cord, and the medial cord. So these cords are made in reference to the axillary artery. Okay, so just imagine you have the axillary artery here at the center. Okay, so what you notice is that the lateral cord will be lateral to the axillary artery. Then, so let me put this spotlight. Okay, just imagine the axillary artery is passing here. Okay, so if you look at the lateral cord will be lateral to the axillary artery. Okay, and if you look at the posterior cord will be posterior to the axillary artery. No, it was named as the posterior cord because the posterior cord is posterior to the axillary artery. Then the medial cord is medial to the axillary artery. Okay, so these cords were named in reference to the axillary artery. To be more specific, they are made in reference to the second part of the axillary artery. If you look at the axillary artery, it has 3 parts. You have the first part, second part, and the third part. So these cords are made in reference to the second part of the axillary artery, where the lateral cord is lateral to the second part of the axillary artery. The posterior cord is posterior to the second part of the axillary artery, and the medial cord is medial to the second part of the axillary artery. Okay, so now I can continue from the cords. You will have the terminal branches. So I can just put T B, terminal branches, or the terminal nerves if you want. So I'll start with the posterior cord. The posterior cord terminates into 2 nerves. One smaller nerve and the other larger nerve. So it terminates into 2 nerves. One nerve is small, and that small nerve is the axillary nerve. The axillary nerve basically supplies the deltoid muscle as well as the pectoralis, not the pectoralis, the teres minor. Okay, so the axillary nerve, if you look at the growth of this nerve, the axillary nerve has 2 divisions. It has the anterior division and the posterior division. But basically, the axillary nerve innervates 2 muscles, the deltoid muscle as well as the teres minor. Then you have this larger nerve. Okay, so this larger nerve from the posterior cord is the radial nerve. Radial nerve. Okay, if you look at the radial nerve basically innervates all muscles on the extensor compartment of the upper limb. So like on the extensor compartment of the arm, you have the triceps brachii muscle. So that triceps brachii is innervated by the radial nerve. On the extensor compartment of the forearm, you have 12 muscles. So all the 12 muscles are innervated by the radial nerve. Okay, so basically the radial nerve innervates all the muscles on the extensor or dorsal compartment of the upper limb. The muscles on the extensor compartment of the arm, as well as the muscles on the extensor compartments of the forearm. Okay. Then from the lateral cord is going to terminate into a nerve that is going to continue straight like that. So that nerve is known as the musculocutaneous nerve. The musculocutaneous nerve innervates all the muscles in the flexor compartment of the arm. So the flexor compartment of the arm has three muscles. You have the biceps brachii muscle, you have the coracobrachialis, and you have the brachialis muscle. So one unique feature about this nerve and how you would identify it is that for this muscle to enter the flexor compartment of the arm, like it pierces the coracobrachialis muscle. So the musculocutaneous nerve pierces the coracobrachialis muscle, then enters the flexor compartment of the arm to innervate the other two muscles. So it innervates three muscles. And again, if you look at this nerve, the musculocutaneous nerve, just by the name itself, musculo, the muscular part, which innervates three muscles, you also have the cutaneous part, so musculocutaneous nerve. So it will innervate the three muscles. Then after innervating the three muscles, this nerve continues as, so after it innervates the three muscles, this nerve, the musculocutaneous nerve, will continue as the lateral cutaneous nerve of the forearm. So basically, it's going to innervate the skin on the lateral aspect of the forearm. So the musculocutaneous nerve has two parts. You have the muscular part, which innervates three muscles. The three muscles, like I said, you have number one, the biceps brachii. The second one is the coracobrachialis. And the last muscle is the brachialis muscle. And after innervating the three muscles, it will continue as the lateral cutaneous nerve of the forearm. And for this nerve to go to the anterior compartment of the arm, it pierces the coracobrachialis muscle. So take that as a takeaway point. So this nerve pierces the coracobrachialis muscle to enter the anterior compartment of the arm. So now I can continue. So that was one of the nerves coming from the lateral cord. Then the lateral cord also gives off another branch that unites with a branch coming from the medial cord. So let me just do this. So you have one branch coming from the lateral cord and the other branch coming from the medial cord. So these two branches, they'll come together to form a nerve. So that nerve is known as the median nerve. Median nerve. Okay, so the median nerve is formed by two branches or two roots. You have one lateral root of the median nerve coming from the lateral cord, and you're going to have the medial root of the median nerve coming from the medial cord. So the two roots, they'll come together to form the median nerve. Okay, the median nerve is the main nerve supply to the anterior compartment of the forearm. The forearm has 8 muscles, but when you look at the median nerve innervates 6.5 muscles. It innervates, so if in short you can say the median nerve innervates all the muscles on the anterior compartment of the forearm except for the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. So the median nerve innervates all the muscles on the flexor compartment of the forearm except for the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Okay. Then from there, the medial nerve is also going to innervate 5 muscles on the hand. Okay. So from the medial nerve, we can continue to the last nerve, which is coming from the medial cord. That nerve is known as the ulnar nerve. So the ulnar nerve is the main nerve supply of the hand. Okay. So basically, this is just a schematic or the skeleton of the brachial plexus. So now you have an idea of how the brachial plexus is formed. Like we had the roots, which were 5 coming from the ventral rami, C5 to T1, the trunks, upper trunk, middle trunk, lower trunk, which all divided into 2 divisions, the anterior and posterior divisions. Okay. Then from the divisions, we have the cords, which are 3, the lateral cord, the medial cord, and the posterior cord. Then from the cords, you have the terminal branches, which I talked about, the musculocutaneous nerve, the medial nerve formed by 2 roots, one root coming from the lateral cord, other roots coming from the medial cord to form the medial nerve. Then from the medial cord, you have the ulnar nerve. Then from the posterior cord, you have 2 nerves, one smaller nerve, the axillary nerve, and the larger nerve, the radial nerve. Okay, so that's just an introduction to the brachial plexus. So now let me continue. If I do this, if you look at the location of these roots are found in the neck region. So they are just behind the scalenus anterior muscle. Okay. So they just emerge between the scalene muscles. If you look at the trunks cross the lower part of the posterior triangle of the neck. So the neck, if you look at the neck in general, the neck has 2 triangles. You have the anterior triangle and you have the posterior triangle. So now just here, we are not doing head and neck. So for this video, just know that the trunk crosses the lower part of the posterior triangle of the neck. If you look at the divisions are at the level just behind the clavicle. You know, the clavicle is one of the boundaries of the apex of the axilla. So just behind the clavicle, that's why you find the divisions. Then for the cords, like I said, they are arranged around the second part of the axillary artery in the axilla. So the cords basically are found in the axilla. And you have 3 cords, the lateral cord, which is lateral to the second part of the axillary artery. You have the posterior cord that is posterior to the second part of the axillary artery. And you have the medial cord that is medial to the second part of the axillary artery. Then from the cords, you are going to have the terminal branches. Okay. So above the clavicle, you basically have the roots and trunks. Below the clavicle, you have the cords and the branches. The divisions are just behind the clavicle. So that's where the brachial plexus is located. So now, even on that diagram, I've already drawn this diagram. Like I told you, C5 and C6 roots, they'll form the upper trunk or superior trunk. Okay. Then the root of C7 will continue as the middle trunk. Then the root of C8, T1 will form the lower trunk or inferior trunk. Then all the trunks are going to divide into the anterior division and the posterior division. Even for the middle trunk, you're going to have the anterior division, the posterior division. Even for the lower trunk, you're going to have the anterior division, the posterior division. Then all the posterior divisions come together to form the posterior cord, which is posterior to the second part of the axillary artery. The anterior division of the upper trunk unites with the anterior division of the middle trunk to form the lateral cord. Then lastly, the anterior division of the lower trunk or the inferior trunk continues as the medial cord. Okay. Then from the lateral cord, you're going to have this nerve, which is the musculocutaneous nerve, and this root that's going to join with this other root to form the median nerve. So this is the median nerve. Okay. From the posterior cord, it terminates into two nerves, one smaller nerve, which is the axillary nerve, and the larger nerve, which is the radial nerve. Okay. Then from the medial cord, it's going to continue as the ulnar nerve. So this was just a skeleton of the brachial plexus. Then you have minor nerves coming from the brachial plexus. For example, from the C5 root, you have this small nerve. Okay, this small nerve is known as the dorsoscapular nerve here. So the dorsoscapular nerve comes from C5. And if you look at the dorsoscapular nerve, it innervates the rhomboid muscles. So for the rhomboid muscles, you have two. You have the rhomboid major, the rhomboid minor, and it also innervates the levator scapulae muscle. So the dorsoscapular nerve comes from C5 root, and it innervates the rhomboid major, rhomboid minor, as well as the levator scapulae muscle. Then from C5, C6, and C7, you have that nerve. So this nerve is known as the long thoracic nerve. So the long thoracic nerve is made up of three roots. It is made up of C5, C6, and C7. And the long thoracic nerve innervates the serratus anterior muscle. So when talking about the clinical application, we'll talk about what happens when this nerve has been damaged. Okay, so the root of C5, C6, C7, they will form the long thoracic nerve, which will innervate the serratus anterior muscle. So on the clinical application, I'll talk about what happens if this nerve has been damaged. Okay, so these are the only nerves coming from the roots. You have the dorsoscapular nerve as well as the long thoracic nerve. Then when you go to the trunks, the only nerves which you see arising, the branches from the trunks, are going to come from the upper trunk. The middle trunk has no branches, the lower trunk has no branches. But if you look at the upper trunk or the superior trunk, you have two nerves that are going to come from it. You have, let me explain on this diagram. You have this nerve, which is known as the suprascapular nerve. So basically, the suprascapular nerve innervates the supraspinatus muscle as well as the infraspinatus muscle. Then you also have another nerve coming from the upper trunk, which is known as the nerve to the subclavius. So it basically just goes to innervate the subclavian muscle. So subclavius muscle. Okay. So only the upper trunk has branches, or the superior trunk, and the two branches are the suprascapular nerve, which is C5, C6, as well as the nerve to the subclavius, which is also C5, C6. Okay. The divisions have no branches coming from them. Then from there, we'll go to the cords. I'll start with the lateral cords. From the lateral cords, you have one branch. So that branch is known as the lateral pectoral nerve. The lateral pectoral nerve only innervates the pectoralis major, and it's basically made up of C5, C6, C7. Okay. So you have the lateral pectoral nerve that innervates the pectoralis major. Then from the posterior cord, you have three branches. You have the first branch, which is known as the upper subscapular nerve. The upper subscapular nerve innervates the upper part of the subscapularis muscle. The second branch is known as the thoracodorsal nerve. Thoracodorsal nerve innervates the latissimus dorsi muscle. Then the third branch is the lower subscapular nerve, which innervates the subscapularis muscle as well as the teres major. So three branches from the posterior cord. Upper subscapular nerve, which is basically made up of C5, C6. Thoracodorsal nerve, that is made up of C5, C6, C7, C8, C6, C7, C8. And lastly, you have the lower subscapular nerve that is made up of C5, C6. From the medial cord, you also have 3 branches. And all the branches have one thing in common. They start with medial. So the first branch is the medial pectoral nerve. The medial pectoral nerve innervates both the pectoralis major as well as the pectoralis minor. That's the difference between the medial pectoral nerve and the lateral pectoral nerve. The lateral pectoral nerve only innervates the pectoralis major. While if you look at the medial pectoral nerve, it innervates both the pec major and the pectoralis minor. Actually, if you look at the medial pectoral nerve pierces the pectoralis minor for it to reach the pectoralis major. Okay. Second branch is known as the medial cutaneous nerve of the arm. So basically, this nerve is going to innervate the skin on the medial aspect of the arm. Then the third branch is the medial cutaneous nerve of the forearm. So it's going to innervate the skin on the medial aspect of the forearm. Okay. So these are the branches which you have to know. These are minor branches. The major branches we talked about, which was the musculocutaneous nerve, axillary nerve, radial nerve, medial nerve, which has 2 roots, the lateral root, the medial root, and the ulnar nerve. So these are the nerves again, just been mentioned, like from the roots, you have the dorsoscapular, nerve to subclavius, long thoracic nerve. But this nerve to the subclavius is coming from not the roots, but the trunk. Okay, so the nerve to subclavius is coming from the upper trunk. Okay, and no nerves come from the divisions. Okay, from the lateral cord, basically we had 3 nerves: the lateral pectoral nerve, the lateral roots of the medial nerve, as well as the musculocutaneous nerve. From the medial cord, we had the medial pectoral nerve, the medial root of the medial nerve, the medial cutaneous nerve of the forearm, the medial cutaneous nerve of the arm, and lastly the ulnar nerve. And from the posterior cord, you have the upper subscapular nerve, thoracodorsal nerve, lower subscapular nerve. Okay. And the distribution, I've talked about this already: musculocutaneous nerve, the muscles of the anterior compartment of the arm, which are the flexors, the 3, the medial nerve, most flexor muscles of the forearm, and I had even put an exception, except for the flexor carpi ulnaris, as well as the medial half of the flexor digitorum profundus, and it also innervates 5 intrinsic muscles of the hand. Ulnar nerve, it will innervate the flexor carpi ulnaris, it will innervate the medial part of the flexor digitorum profundus on the forearm. Then it is the main nerve supply to the hand. So all the muscles of the hand are going to be innervated by the ulnar nerve, except for those muscles that are going to be innervated by the medial nerve. The hand has 20 muscles. So 5 muscles will be innervated by the medial nerve, then the rest of the muscles will be innervated by the ulnar nerve. If you look at the axillary nerve, it innervates the deltoid, the teres minor. Radial nerve innervates all extensor muscles of the arm, forearm. Dorsoscapular nerve, like I said, to innervate the rhomboid major. So this is the rhomboid major, rhomboid minor, as well as the levator scapulae. So these 3 muscles are going to be innervated by the dorsoscapular nerve. Okay. Suprascapular nerve innervates the supraspinatus, infraspinatus. Okay. Upper subscapular, I've already said, subscapularis muscle, upper part of the subscapularis. Lower subscapular to innervate the lower part of the subscapularis, as well as the teres major. Okay. Then you have a point that is known as the Ebb's point, which you have to know. So if you look at the Ebb's point, it's a point where 6 nerves come together. Okay. So you have C5 root, 6 C6 root. So these two roots, they form the upper trunk. And from the upper trunk, I said you have two nerves coming from it. Suprascapular nerve and the nerve to the subclavius. Then the upper trunk is going to divide into the anterior and posterior division. So basically you have 6 nerves that come together at this point. So you have C5 number 1, C6 number 2. You're going to have nerve, suprascapular nerve number 3, nerve to subclavius number 4, anterior division number 5, posterior division number 6. So these, they come together at this point, and this point is known as the Ebb's point. So you have to know what happens when you damage this point, okay? If you damage the Ebb's point, you're going to have the condition that is known as Ebb's paralysis. I'll talk about it. So let me start with the clinical application, the lesions of the brachial plexus. So I'll talk about the lesion to the long thoracic nerve. I'll talk about the lesion of the suprascapular nerve. You have to know this. Upper trunk lesion, which is basically Ebb's paralysis, because this is the upper trunk. You have lower trunk. I'll talk about it, which is clamp key palsy. I'll talk about it. The cords, lesions to the axillary nerve, lesions to the musculocutaneous nerve, a bit of variations, and brachial plexus block. So Ebb's palsy. So like I said, Ebb's palsy is a condition that is known when you damage the Ebb's point. Okay, and mostly the cause, when you look at the cause of this injury, it happens when there's forceful separation of the head from the shoulder during delivery. So as the baby is coming out, you know, especially when the child is big, you know, like you need to give assistance, like you need to at least help the child in coming out by pulling. Okay, so now imagine these are the hands maybe of the midwife, the doctor, the nurse. So as they are pulling the child out, you know, now imagine if they use force. If you use force, you can damage the brachial plexus, which arises from the neck region there. Okay. Or maybe when someone falls on the shoulder. So now, what are the roots that are affected in Ebb's palsy? So Ebb's palsy is damage to the upper trunk. And the upper trunk is made up of C5, C6. Okay. So now, if you look at the child presents in this manner. Okay. So you have this feature where the hand is in that direction. Okay. And you know that direction, you can simply call it the policeman's tip or the waiter's tip. Imagine the waiter wants to get a tip and they don't want people to see that they're trying to get a tip. So they basically they'll be in that position so as you give them the tip. Okay? Or even the policeman, imagine the policeman wants to get a tip. They don't want people to see that they're getting that tip. Okay, so they'll try by all means to hide. Okay, so now you have this condition that presents in that same manner. So you can see, so the child is going to have the waiter's tip or the policeman's tip appearance. Okay, so they'll also present with the arm hangs by the side, like the arm is adducted. So there'll be no abduction. Okay, so the arm will be medially rotated. There will be extension at the elbow, and the forearm is pronated. Okay, so this forearm is pronated. There will be extension at the elbow. The arm is going to be adducted. So these are the features that are going to show with Ebb's palsy. So just know Ebb's palsy damage to the upper trunk, and it happens either during forceful separation of the head, during childbirth, or fall on the shoulder. Then now what happens if you damage the lower trunk? Okay, so now imagine the hand of this child presents first during delivery. Okay, so now and you pull the hand with force, so you can damage the lower trunk. Okay, so damage to the lower trunk is clamp key palsy. Okay, so imagine you're pulling the child or you're holding on to something like that. So you can also damage the lower trunk. Okay, so now how does it present? So it presents with claw hands. Okay, these are claw hands. So basically, these are the conditions which you really have to know. Okay, you have to know Erb's palsy, you have to know Klumpke palsy, and they didn't mention like if you damage the long thoracic nerve, you will have a condition that is known as winged scapula. So if you damage the long thoracic nerve, you will have a condition that is known as winged scapula. Okay, I think these are the conditions which you really have to know. Okay.